Hi everyone, I did my presentation on 2 health education professional organizations. The first organization is the American School Health Association, and their mission is to transform all schools into places where every student learns and thrives. Their vision being that healthy students who learn and achieve in a safe and healthy environment are nurtured by caring adults functioning within coordinated schools and community support systems. So ASHA is based off of 5 core beliefs, and core belief 1 being that health and learning are directly linked and essential to the development of healthy, resilient citizens. 2, schools are uniquely positioned to help students acquire healthy habits for a lifetime. 3, a coordinated school health approach is the most effective and efficient means of promoting healthy citizens. 4, school health professionals should be highly qualified and practice evidence-based health and education strategies. And lastly, core belief 5, schools should be a safe and nurturing environment that facilitates learning for all. So in order to become a member, there are 3 different types of memberships that you can have. You can have regular, student, or retired. And so for regular, it'd be at a rate of $165. Students and retired memberships are $80, but in order to have a retired membership, you must have been an ASHA member for at least 10 years, and the organizations are at a rate of $575. ASHA does not have any publications, but they do offer their members many accesses to other publications such as the Journal of School Health and School Health Action, and then many other career centers and comprehensive health education networks. ASHA advocates for all issues that tie to their mission statement about transforming all schools into an optimal place for students. They commit to whatever they can in order to provide each student success and building a strong and effective relationship between the families and schools. And so they provide it's important because they provide scholarships, events, and many resources to all of their members. And the impact that ASHA has in our world is beneficial. They continuously provide new research tools that provide support for the idea that students will be able to have the opportunity to learn and thrive. The next organization that I researched is the Association for Professionals in Infection Control and Epidemiology. And their vision is that there's healthcare without infection. Their mission is to create a safer world through the prevention of infection. And so as an organization, they collect and analyze health data in order to keep track of the current health infection trends, and then they report that data back to the public health agencies. They design infection prevention practices and collaborate with healthcare team, and they work with healthcare facilities by isolating sources of infections and limiting their transmission, so preventing the spread of the germs, and then educating healthcare personnel and the public about infectious diseases and how to limit their spread. And so they do offer many different resources such as guidebooks, manuals, and just graphics of how you can prevent the prevention of diseases and germs. And so to join, you can just get a membership at a rate of $205, and not only are you able to enroll, but you can also join an APIC chapter or section. And so the local chapters are basically areas where people who have the similar interests will be able to attend educational events and other volunteer and professional development opportunities of people just in your area. If you're not able to find a local chapter, then you can join a section, which is basically an online virtual community. And so there are 13 different virtual communities. You can join one or all 3. And so it's a great way for members to join and have that have similar interests, and it's a great way to exchange ideas and talk about the different practices that are used today. APIC is important because they have many different publications that are offered to their members, and such as Prevention Strategies, which is just a magazine that provides evidence-based strategies and practical guidance. The Scientific Journal, which is full of peer-reviewed articles of infection prevention, and then other resources for publications as well, such as Infection Connection, e-news, and then Preventing Infection in Ambulatory Care. APIC is essential to our world today because they constantly collect and interpret health data in order to come up with new alternatives in order to prevent infection.